So we're going to move on now to the next item, which Paul Taylor will introduce, relating to the integrated finance and accounting system for the board.
Thank you, Chair. At the last meeting in private, the board approved the concept of buying an integrated finance and accounting system for the commissioning board, but also for all of the clinical commissioning groups as well. At that stage, it was subject to gaining further authorisation from the DH and the Cabinet Office and securing sufficient resources in 2012-13. Pleased to be able to tell you that we achieved all those things, and David and I signed the contract on the 29th of March under the terms of a framework agreement between the NHS and Shared Business Services, who are a joint venture between the NHS and Steria. What this means in timing terms, we anticipate, is that we will have a single accounting system for the commissioning board from the 1st of October 2012, and then for all of the different clinical commissioning groups from the 1st of April 2013. It will be a common system with a common chart of accounts, which will mean that if you're in anywhere within the commissioning part of the architecture, when you're putting your hands on an accounting system there, it will be the same in form, same in structure, and it will allow us to consolidate the numbers of the NHS much more readily, and it will give us a very solid understanding that there's a real detailed financial discipline going on in each of the CCGs and in the commissioning board, all to the same very high standard. The terms of the deal are commercial in confidence, but they have been agreed as being value for money. We've got an annual contract value of just over £15 million. The crucial factors within that, though, are the number of CCGs. So we've set the contract at the moment for 230 CCGs. So if we're down at 220, that will improve the price slightly. Because clearly the number of organisations you're producing books for has an impact on the back of that, but also the number of transactions that actually get processed through. So we're talking about 2.7 million invoices every year being processed through this system. We ought to recognise that from the finance perspective, from the finance community, this is a big deal for us. We've long worked to try and get a common system between the PCTs and between the trusts within the NHS, and we haven't managed that yet. So actually, every finance professional I talk to thinks this is a good call. We have involved the CCGs and CCG representatives as well, and again, on the whole, they're very happy to have a common system. It's not one of the things that was high up their list of things that they wanted to do. And so actually somebody saying, actually, you're going to use this one and it's going to be implemented for you. And crucially, the commissioning board is going to pay for it as well. And that went down quite well with the commissioning groups at the same time. So that's the good news. The difficult part is the fun starts now on this, because actually, having signed the contract, we've now got to get it implemented in 231 different places, plus all the locations for the commissioning board. So we've got a very extensive implementation plan already arranged with SBS. We're taking on our own implementation team to manage that through. Commissioning support units are absolutely crucial in this, because they'll be the super users of the system. And they'll be the people who are working with the CCGs and actually doing a lot of the difficult work, a lot of the final accounts work on behalf of the CCGs. And so it will be through, from the commissioning board through to the support units down to the CCGs that the actual network will flow. So that's the crucial part of it. What I'm asking the board to do is note that Dave and I signed the contract on the basis of the delegated authority you gave us last time round, and reaffirm this commitment we gave that every CCG will need to be using this system, otherwise it won't be worth having. So therefore we do need to make it part of the authorisation arrangements, and then confirm again that the commissioning board will be meeting the cost of this system centrally. It's a 6-year contract, but with a break point at the 31st of March 2016. The thing I didn't put in the paper is the thing this system doesn't do is contract management. And it's really strange for a commissioning organisation not to have an integrated contract management and a finance and accounting system. I think that needs to be our ambition from April 2016. Once we've got this system in, we need to start working again to see whether we can't do something that manages the contracting mechanism as well as the recording of the finance and accounting. But one step at a time, I think.
Paul, thank you for that. I mean, I think this is a very significant step forward to have a common chart of accounts and to have a single finance and accounting system, both for us and for the CCGs. And just for an explanation of process, the approval was given by this board to this procurement in a private meeting the last time around and under reserved business because it was commercially confidential. And today we're reporting the outcome of that. And delighted to record that the agreement was signed. Before I... Yes, Ed.
Yeah, I mean, firstly, congratulations, because I think getting this contract delivered is important. In fact, I'd say more than that, it's essential for us to have a standard chartered accounts where we can consolidate and report. So that's the sort of that side of it. I guess the one that I'm really interested in going forward is to work through the utility of having this system in terms of the benefit to the CCGs from being able to benchmark, from being able to compare and deliver value back into our CCGs. And is that part of the expected process? And should we be encouraging a relatively early start on that front?
Absolutely. We need to do some more work just to understand the confidentiality of the data. Clearly, we wouldn't get into any of the transaction detail element of that. And we need some agreement with the CCGs of their willingness to share some of that data. But certainly at a more aggregated level, it would be very easy. One of the real benefits we're going to get is because we're going to be using a common chart of accounts, we will be able to add all the payments to a nursing home, a trust, even to a water company together, to actually work out what it is that we're paying them in that way, and then hopefully leave a better deal on behalf of patients on the back of that. So that's certainly one aspect of it. The other big bonus from, again, this is more a technical thing than a patient-centred thing, would be we spend a lot of time at the moment doing a lot of reporting through to the centre, quite appropriately for reasons of governance with the public vote. To get this system right, we ought to be capable of doing that via reporting. At the moment, we spend days filling spreadsheets in trying to get those numbers in a similar sort of way so they can be added together and then consolidated. This system ought to allow us to run a report on the back of that and do it. So we've got to get we've got to get the chart of accounts right, because that's going to be crucial on the back of that, and then we've got to get the implementation right so everyone's using it in exactly the same way.
Thank you. Very good. Right, I'm sorry. Yes,
Sorry.
Barbara.
Paul, just a point of clarification, I think, on the back of your mention of confidentiality, which I just think is quite important, is that commissioning support organisations or services using this instrument will be doing so as the agents of CCG. So it's not that they will have access to it out with that. It is that should the CCG give the CSS the responsibility to undertake that.
No, I mean, a typical CSU might have, 7 or 8 CCGs. It would have to maintain client confidentiality with each one of those. It would be running them on the same system. It would be logging onto them independently in terms of how it worked. But it's one of the advantages for the CSUs is the ability to be actually manage 8 or so CCGs actually using the same system, because the staff will just be logging on and will be used to the routines on the back of that. The confidentiality issue is just one of, are you happy for me to share your information? So we just need to get some agreement on what level of agreement, what level of happiness we would be. As the commissioning board, we're going to need we're going to have to insist on some level of reporting, because we've got to do that consolidation thing. When we report to the department about how much commissioning in the NHS has spent, we're doing that for ourselves and all 220 CCGs. So we need to be capable of running that report Individual CCGs, though, we just need to broker a deal that sort of says, if you want to know how much they're spending on that contract, you'll either have to ask them, or we'll have to get a broad agreement on what you can look at.
Yes, and I suppose it was as much the clear understanding that the CSSs only had access to this system as the agents of the CCGs, rather than that they were an agent of the board, which had access to this without
that's a really good point.
Yeah.
No, they are effectively, it's the CCGs who are commissioning the CSUs to actually work on this on their behalf, isn't it?
And it's such access as the CCGs wish to give.
Yes.
the
Absolutely.
CSSs.
Absolutely.
But presumably our thing on this must be transparency. I mean, we want to we're not just, we need to advocate something here, don't we?
Sure.
We need to make sure that as far as possible all this information is out in the, because it's important for their local populations and their public as well as others to do that. Yeah.
Kieran?
In terms of Bill's risks, it sort of nails a lot of the second one, but the implementation as ever, how confident are we that it'll be the great IT project management that it needs to be, etc., etc.?
Well, SBS are already geared up and are doing the implementation, and in fact are sort of chomping at the bit to know who are the CSUs, who are the CCGs, what's the name of the sector managers. They asked me yesterday, because they want to get in there and actually start to have those conversations. So there is a risk on the implementation just in terms of getting our side of the shop sorted out. I'm confident they've geared up enough now with project managers and technicians to be able to do that. We've got to get some really good NHS finance people on board now to actually do the implementation from our side.
It's our side, not. Okay.
Okay, I'm going to invite the board to do two things. One is to approve a requirement that the use of this system should be a condition of authorisation for CCGs. Are you happy to do that? And secondly, that the full cost will be borne by the board for the 6-year run-through of the contract, albeit from 2016 you're looking to add a contract management module.
Yeah, we've got a break clause there, and that's just an ambition that I've set for us really, to see what we can do on the back of that.
But the implementation cost and the annual costs will be borne by the board for the full 6-year period.
Absolutely.
The board happy to approve that?
Very.
Good. Okay. Thank you very much.